Assalamu alaikum. Today I am going to discuss regarding the very hard vaccination plan. Vaccine is more important than the treatment. Simple, someone says that prevention is better than cure. So you need to immunize your herds regarding the prevalent disease which is present here in Pakistan. Most of the present diseases here in Pakistan is FMD, which is in Urdu called Mukur, H.S hemorrhagic septicemia, which is known as Galgoto, and other diseases like 3-day sickness and Brucellosis, Clostridial disease, and bovine ephemeral fever. Now one new disease like lumpy skin disease. This is recently reported in Pakistan, and most of the farms are infected. So it is better to make the vaccination plan properly and execute it properly. If you are using any vaccine one type, you need to continue the same brand for the next also, and no need to change sudden from the one brand to another brand. Some vaccine that is needed to be repeated after 4 to 6 months, like FMD vaccine, most of the times herd immunity titer is going down, then you need to repeat before that time. Some people recommend that it should be repeated after 6 months, and some recommended after 4 months, but this depend on the your management decision. Maybe you go for the 6 month, and maybe you go for the 4 month, but my recommendation is 4 month. And always when you are going for the vaccine to be give the booster dose or herd that to be repeated, especially for the FMD, you need to take the serum sample and test for the antibody status. So you will know the situation will be clear in front of you that should I go now or wait for 1 or 2 months. And at that time you can develop your standard that should I continue by 4 months or 6 months, but my recommendation to go for the 4 months. Commonly used here in local and corporates and commercial dairy farm is H.S Vaccine, hemorrhagic septicemia vaccine. Two type of vaccine is mostly using in Pakistan. Some farms are using the imported vaccine, New Bacteria, and some farms are using the local manufactured vaccine. Local manufactured vaccine in the HS giving good result, and most of farms are satisfied with that. But again, this decision is on your farm management if they want to stick with the imported one or they want to utilize the locally manufactured one. But in this case, I am also recommending the local manufacturing vaccine in the HS is best, and they are giving good result. Bovine ephemeral fever, this is the virus disease, and most of the farms are using vaccine against this disease. This vaccine is recommended one shot in a year. You can go in February and March, especially because most of the outbreak occurs in April. So you need to vaccinate your herd before the outbreak. Against the Clostridial, different vaccine are present in Pakistan. One is Clostrivax, and one is the Covaxin 10. That's both vaccines are the imported vaccine, mean not manufactured here in Pakistan, and it is giving good result. But this vaccine also recommended twice in a year with the interval of 6 months. Another vaccine for the BVD, Leptospira and IBR. It contains the different strain, also about 9 strain in this vaccine is present. Leptospira is different strain is present, and this vaccine is recommended twice in a year. This imported vaccine is available for this because it is not manufactured in Pakistan. Different brand is present. I will say one brand is Supravac 10, which is available here in Pakistan legally, and another is Elite 9. One available brand you can use for this disease because it gives the immunity and giving good result. And this vaccine is also recommended to be used twice in a year. Another thing, you can use this vaccine in the close-up animal also, so it gives immunity in passive immunity for the calves, giving antibodies in cholesterol. RB51 vaccine is using for the brucella. It contains the strain 19, and this vaccine is used after freshening, mean after delivery. You can inject this vaccines usually after 21 days before you start the breeding protocols. For the brucella, the vaccination plan is different, and most of the experts recommended different plan, but now I am discussing one simple plan with you. that's RB51 strain 19 usually starts the first dose at the age of 4 to 6 months in young stock. The booster dose should be repeated at the age of 12 to 14 months, and then next third dose usually recommended after the calving. Third dose usually recommended after calving. When the calving stress finish, especially after 15 to 21 days, or even when 21 days pass, animal recover from the calving stress and the immunity start build up and cow start recovery from the pasteurization stress, then you can use this vaccine. Expert people are recommended in close-up group, mean the close-up is the group before the calving, or some people say the steam-up group to this. So this vaccine is recommended for the especially, and it is not only for the developing immunity for the cows, for that cows, but this is for the passive immunity of calf. This vaccine contains rota and coronavirus and also E. coli. The aim of this vaccine is to give the protection to the calf against the rota, corona and E. coli. This vaccine is recommended to be used in the close-up group. Cows and heifer are shifted to the close-up group. So at that time you will use this vaccination. Every dairy farm owner, dairy farm farmer should give more focus and concentration on the vaccination plan, because this is the only one stage that you can control or prevent the disease outbreak. Once the disease is there, then the huge losses is recorded even in the form of mortality, loss of production, and in most of the cases death is also recorded. So better to stick with the vaccination plan with the proper timing and proper schedule. Efficacy and efficiency of vaccine. At the start of the video, I mentioned one para that prevention is better than cure. It means that if you invest in the vaccination, sure it will give the result, and in the time of outbreak, in case any outbreak happen, intensity of the disease will be best if you are stick with your vaccination plan. The efficiency of vaccine is depend on the different factors. First factor, that the manufacturing facility, technology which they are using. Another factor, the cold chain. If the cold chain is properly maintained and transported properly, and you also kept in the good storage area, it will give good result. Another thing is depend on the proper dosage. It should be used according to the dose which is recommended by the company. If the dose is decreased due to your technicians or due to the negligence of the applicator or misreading, any vaccine that anyone using should read the literature properly and should know the proper doses and try to implement that doses. Another factor which is affecting the vaccine efficiency is your cow immunity. If your cow immunity is weak, already in weak status, or this is the heat stress condition, then the immunity will be developed slow or less. You should use this vaccine in the stress peak condition, especially early morning or late in evening. In cold time, if you are using this vaccine, sure its efficacy will be better and it will give a better result. After vaccination, it will affect the production of milk. Sure, any vaccine or any product or injectable product that are using, it will bring some stress on cow. Due to that stress, it will affect their production because you disturb the cow comfort, and it is the necessity for the development of immunity for the cow. So need to bear that losses also, and that loss is temporary, because sometimes if anyone is using vaccine, the production is affected, and after 1 week or 10 days this production is restored or gain that production. Hard vaccination plan, always keep your vaccine in the cold container. This is the like cooler, because it will maintain the temperature, cool temperature, and at the same time need to utilize the ice block. You can see this is the ice block, so it will maintain its temperature. Thank you for watching video.